Islamic microfinance is becoming an increasingly popular mechanism for poverty alleviation, especially for developing countries around the world. This microfinance service adheres to the principles of Islam as a form of social responsibility. Yona Islamic Microfinance is the Islamic microfinance of choice in the Gambia, trustworthy and reliable. At Yona Islamic Microfinance, we provide savings products, current accounts, financing products in conformity with Islam. In addition, Yona Islamic Microfinance also offers local and international remittances, takaful fund, management of zakat, management of awqaf, trading and investment, and building of strategic partnerships to bring financial services to the doorstep of the poor with donor projects, madrasas, youth organizations, women groups, and farmer organizations. Make a choice with Yona Islamic Microfinance today. For more information on Yona Islamic Microfinance, call 377-2151 or 9832-151 or visit Yona head office at Tipa Garage, Bakote, or visit any Yona branch located countrywide near you.
Brother Kendall, how do you solar lampol make this look? I can't manila for a solar enterprise. For the Mungul and Yimbanko can get them to it.
Sumanu baro, Unjurunko, Ikonga Faleko, Namu Badabanta, Bila Blazola, and Yagambia Vino, Amira Solar Enter, Nasola Enterprise. Solar Nimbati can do, Kuran, Deda Sala, Aboros in Enamo, Kagis and Odila, Amira Solar Enter, Nasola Enter, Nasola Enterprise. Ah, Jaliwo, Solar can desato, yeah, Jaliman Fofina, O Solar can desato. Na enterprise, Sumanu baro, Unjurunko.
Welcome to Bundu Maternal and Child Health Hospital for a presentation ceremony. My name is Omar Sise. I am the Public Relations Officer of the hospital. So I use this opportunity to welcome the Deputy Director of Health Services, Dr. Nyasi, our able CEO, Dr. Mamadi Sham, the representatives of Seattle Gambia community in the US and in the Gambia as well, the representatives from various facilities present, media and all other protocols respectfully observed. So this is refreshing to see something like this, because if all of you could recall, when COVID-19 broke out, we were all stressed. Even if you have resources, some of these materials were not, and consumables were not easily accessed. So having a presentation of that could only mean that you are helping us improve the services that we deliver to the people of the Gambia. At this moment, I would like to call our CEO to give a welcoming remarks as the host institution for this incredible presentation today. Dr. Mamadi Sham.
They mobilize resources for the Gambia, and they contribute to the development of health and health service in the Gambia. This time round, it comprised of surgical gloves up to the tune of 16,000. This to be distributed across the country in all health facilities, and the health facilities being identified are as follows. In order of alphabetical order, Albreda Health Center, that has nothing to do with me from coming from Albreda, Bansang Hospital, Basse District Hospital, Bundung Maternal Child Hospital, Brikama District Hospital, Biam General Hospital, Edward Francis Small Teaching Hospital, Farafenni General Hospital, Janjambure Health Center, Kanifi General Hospital, Kerawan Health Center, Sukuta Health Center, and Sehzait Regional Eye Care Center. These hospital and health centers were identified because of the deliveries they identify and they conduct annually. And it could be noted, you will agree with me, that it's only Sehzait that doesn't conduct deliveries. So, but being a hospital, we included it in because they do some surgical activities. May I use this opportunity to thank all those here present and also the donors for not forgetting home. Some of these things could be very expensive if we are to buy these things. And 16,000 surgical gloves is huge amount of money. So on behalf of Bundung and all the other health facilities, I thank you and God bless you all.
On behalf of my colleagues and friends, Ibu Cham, Suleiman Jobate, Winifred Sidibe, Fatou Konate, and myself, Lang Conte, I am glad to present these donations to the Health Department of the Gambia. These donations consist of 16,000 pairs of sterile surgical gloves, of both latex and non-latex gloves, and 100 boxes of surgical sutures, which are absorbent and non-absorbent sutures, which will count about hundreds of individual sutures to 1,000. It is difficult to put an exact value to these donations. However, we can estimate its value to be anywhere around $125,000 to $150,000, which is over $6 million. Ibu Cham, Suleiman Jobate, Winifred Sidibe, and I are all anesthesia providers working in the United States of America. We all share the love for this country and the willingness to help in improving its healthcare through both voluntary clinical services and collaborating and educating current and future healthcare providers here. Hence, we form an organization called Root Health Services. The mission of this organization is to promote better periodic services delivery in the Gambia through networking, mentorship, medical mission, human resources development in collaboration with individuals and entities. Although in its early stages, but through this organization, we have already donated multiple medical equipment and supplies, such as laryngoscope, handles and blades, multiple surgical equipments, and multiple textbooks, including anesthesiology textbooks and nursing textbooks. And these items and books have been distributed to the hospitals in the Greater Banjul area. We have devoted our personal resources in obtaining and shipping these items here to the Gambia. We did it because it is the right thing to do, and we are not seeking any reward or any recognition. All of this were done with the help of Mr. Fatou Konate, who is here with us today. He also devoted his own personal time and resources because he shares the same love for this country. Fatou, thank you for what he's done for us. And we would also like to thank Dr. Mamadi Cham, who has supported us and guided us in distributing these items. Thank you, Dr. Cham. So the state of healthcare in the Gambia and across Africa has always been a challenge. In my view, multiple factors might have contributed to this, such as 1, lack of preventative care, 2, shortages of medical equipment and supplies, 3, medication shortages, 4, the challenge of training and maintaining healthcare providers or professionals, 4, the cost of care. Because of this, many of us tend to seek medical care in the Western world or countries outside of Africa. This problem is not only unique to the Gambia, but the entire continent of Africa. Although these are difficult challenges, I believe that we can overcome it all because we are people and nations of great strength and resilience. Think about it, as Africans, we have been enslaved for hundreds of years. We've been colonized, we've been marginalized, treated inhumanely for centuries, yet we are still here surviving. It is known that Africa is the birthplace of human civilization. We have the world's vast reserves of natural resources. Our geographical location is unique. We have intellectuals and bright minds living here in Africa and all over the world. We have it all. But yet it seems like we have nothing. We have to change this, and we must change this. But changing this requires us to do a few things. One, changing ourselves at an individual level. Two, taking personal responsibility. Three, being accountable for our actions. The fourth one is whatever we do, let's do it with honesty and integrity. And of course, educating the young ones and changing our perspectives about Africa. I am very passionate about this because I firmly believe in Africa's independence and relying on ourselves. And yes, we can do this collectively, and this is what Root Health Services is about. Without taking much of your time, I would like to hand over these donated items to the CEO and the Deputy Director of Health here today. Hopefully these supplies will be used as intended. We are calling on all Gambians and non-Gambians to come out and support the healthcare system of the Gambia. Because attaining good health is not only a necessity, it is among our basic human rights. So for Root Health Services, our organization leadership is as follows. The president is Ibu Cham. He is born in Alberta and Joffre, resides in Seattle, Washington. He's an anesthesia provider. The vice president is Winnie Sidibe from Makati, resides in Minnesota. Secretary General is Suleiman Jobate from Makati, resides in Seattle. And treasurer is myself, Lanconte, resides in Seattle. I'm from Badibu Bani. And our accountant is Charles Cisse from Brikama. He's doing the work pro bono, and he lives in Seattle. And our country coordinator is Parboy Konate, who is here with us today, resides in Dibakunda, also resides in Seattle and Brufut. Our aim and objectives are, one, to collaborate with organizations and institutions in the United States of America and the Gambia that shares our organization's missions and aspiration. Two, to provide clinical support to local anesthesia providers in the Gambia. Three, to build continuing education program for anesthesia and other health professionals in the Gambia. Four, to provide curriculum development support for the University of the Gambia anesthesia program. Five, to solicit donations of anesthesia and other perioperative items to the country. Six, to provide mentorship to local anesthesia professionals and students. And seven, to arrange medical mission trips by liaising with other medical groups and organizations based in the USA. We'd like to thank our donors, such as the University of Washington Medical Center, Prosa Memorial Hospital, Cheryl and Bill Chelsom, and countless of individuals who have contributed towards this effort, such as Alimame Drame and Lamin Samra, both Gambian living in Seattle, for the shipment of these items at significantly discounted rate. We thank the Minister of Health in the Gambia and all the healthcare professionals for the work they are doing. Thank you all.
It is a great pleasure for me to be here to witness this handing over of very important and useful material that are going to support our health service delivery on behalf of the Ministry of Health. So the senior SMT members of the Ministry of Health are unavoidably absent due to a very important meeting in Geneva, but they have asked me to convey their greetings and thanks to the Roots Health Services for the wonderful gesture they are presenting to the government through the Ministry of Health. And they are very grateful, and they are looking forward to receiving more beneficiary support from the associations. As somebody mentioned here, when COVID-19 struck almost 2 years ago, we were taken unaware, and it has revealed some of the weakness of our health system. And nonetheless, it has also taught us a lesson, and it has helped us to now prepare ahead. And that is what we are doing now, to make sure that no other pandemic can take us unaware. And this is why we have intensified our training, our surveillance system, our preventive aspects, and the treatment part of it. But all these things cannot be done by the government of the Gambia. If you look at our health expenditure for the past 2 years, almost more than 50% has been centered on COVID. And other health-related aspects are facing a lot of challenges in terms of receiving support. Especially, there was a time the country ran of surgical gloves. Could you imagine a system without surgical gloves? Sometimes you have an operation, they said, well, it cannot be done because of there are lack of surgical gloves. Not because of the government cannot buy, it's because there are so many embargoes in the West, because they needed also those materials to curb the spread of COVID-19. That's why we had a lot of challenges. So the pair of gloves that used to cost about $10, it was costing about $150 and $200. Could you imagine the situation we were facing? So the kind of support we are receiving today to support our health facilities will definitely go a long way to improve our health service delivery. And on behalf of the Minister of Health, I would like to thank our colleagues from Roots Health Services for their support they have been doing. And I pray for all the members of the Roots Health Service Association for them to have good strength to make sure that they continue to support the country through the Ministry of Health for a longer period. As I said, these products, as I said, we have a good leadership in the country, in the Ministry of Health, and Dr. Chan with his colleagues leading the health service delivery will make sure that these material given will be judiciously used for the benefits of our people. It is very important, as I said, government alone cannot do it. We need support like the Roots Health Services and other partners who have been supporting the Ministry of Health for the past year. So this is one of the things that we are hoping to receive from people to support us, and we will make sure that, as I said, the leadership is on the ground to make sure that these materials are used for the benefits of our country. So on behalf of the Minister of Health, I once again thank the Roots Health Service for the wonderful gesture they have provided it, and I'm looking forward to make sure that we continue to collaborate with them for the interests of the Gambian people. As I said, we are all in it together. Nobody can achieve the health system of this country alone, but collectively, with a common interest, with a common goal, we can reach there. So I'm sure the type of togetherness we are experiencing with the Roots Association will help us to move this health service delivery of this country forward. Thank you once again for this opportunity.
It was a short notice when I contacted Dr. Mamadi Cham, and he did a good job to coordinate all these things. He made this thing happen because we don't know the stats exactly how we're going to distribute this thing. So with the help of Mamadi and my colleagues back down there, we map out things together and figure out how we're going to distribute this thing. And the other thing is, like, I'm just saying thank you to the media folks. It was short notice. It's like a day notice. And everybody was here. My own sister, Fatou Kamara, Kerr Fatou, how do you call it, West Coast, Mimbe Kering, Fadera is here, GRTS, The Point, everybody saw up on time. They are here way before time. So We can't thank you guys enough for doing this thing. The other thing is I'm saying thank you to my people down there, Mr. Ibucham, Pa Suleiman Jabate, Winnie Sidibe, Mr. Lanconte, and Charles. This is awesome. To put all this thing together, it's a big thing. And they use all their own funds to ship this thing. It costs over $1,000 to ship these things here. All these materials cost over almost like $125,000. That's a lot. So thank you to each and everyone for coming. Thank you so much. I hope this thing will help. It will give us a long way. Thank you.
I say a very big thank you to Roots Health Services for giving us this donation that will go a long way in closing the gap for demand for gloves. As we all know, surgical gloves are one of the highly demanded consumables in the hospital, because surgical gloves are used by almost everybody in the hospital setting, ranging from the doctors, the nurses, the oxygen attendants, nurse attendants. Almost everybody uses surgical gloves. So on that note, I say thank you so much, Roots, for giving us this donation that will go a long way in supporting the healthcare services. Thank you so much. Thank you.
Agada.
Mbijan aganyadi.
Albaka.
Mbaka important.
Yo, nga transfer la sto.
Ya transfer la sto.
Ha, code nyenji.
Okay. What's Nsila ID soto.
Ha, sa soto. Sorry. Agada.
Mbijan bro.
Albaka.
Mbaka.
Bara alla service o tariaka.
Ah,
mbale. Mo ki janna nun kunu bara tariaka.
Jannom yona forest de bureau. Gambia tonkon na no mbali ya bere. Birim koyna fo kato.
Bari si kodo kino kato nim fo bolong blabe.
56 branches mola soto Gambia jam.
Ha?
Gambia kono ani Gambia bantala bankol. Nka kodo kiya bere. Kodo sifa fo falindiro fo nyaadi lafta même na kodi topoto nin kodi maraw. Jannom number 1 ti nyonta. Andum fana nata anoda enterprise sotale. Wolam nyindi ko domorol fana kol fana be firale de dadi man domorol dir fana beteat. Gambia dawda yalo ngam fa kendol sotale je.
Wo moyo diat ha.
Apelenta
baraka ba. Ni lafta nyelen kendol e bina.
Yalo bukani la ko la baraka ba.
Yalo ndel chosano lo.
Baraka.
We live in a day and age where technology is creating a world without borders, filled with unlimited potential to improve the lives of the people around us. Innovarex Global Health ushers in a new way of leveling the playing field with increased access to quality healthcare services delivered at your doorstep. Our qualified professionals are equipped with state-of-the-art point-of-care testing technology to conduct tests such as kidney function, liver function, electrolyte tests, body composition, hemoglobin, A1C, and many more services with the highest efficiency in delivering results. The addition to our flagship Wellness on Wheels, more fondly known as WOW Delivery Service, brings the entire clinical experience full circle IGH has remained committed to creating the future of healthcare delivery. Gone are the days of sending loved ones outside the country for basic medical services. Innovarex Global Health offers a new peace of mind and takes pride in delivering the quality of care we all deserve.